Hi, my name is Elena Quintanilla, and today I'm going to talk about hypoparathyroidism. Definition: hypoparathyroidism is a rare endocrine disorder in which parathyroid hormone production is abnormally low or absent, resulting in low serum calcium and increased serum phosphorus. The most common cause of hypoparathyroidism is parathyroid gland injury or inadvertent removal during thyroid surgery.
Hypoparathyroidism. We wish we had an easier name for it and a shorter name. It doesn't flow easily. Is a rare disease where the parathyroid glands don't work or don't work well. And that's different from the thyroid that most people know. Very different glands. And they're responsible for keeping our calcium in the blood at normal range. And if they don't work well, you have low calcium, low PTH, and that's called hypoparathyroidism.
Patients who have hypoparathyroidism will have low levels of serum calcium, that's called hypocalcemia, and they'll have elevated levels of phosphate, and that's called hyperphosphatemia. So the combination of a low calcium and a high phosphate really is the biochemical signature of hypoparathyroidism.
Application in medicine. Recent studies have shown an increased risk of posterior subscapular cataracts, likely due to elevated calcium and phosphorus product occurring in lenses in the eyes. Basal ganglia and intracerebral calcification may be associated with extrapyramidal movement disorder and psychosis, but not all studies have confirmed an association. Increased risks of cardiac arrhythmias and cardiovascular disease have also been reported.
Hypoparathyroidism arises when the parathyroid glands are unable to perform their function. There are normally 4 parathyroid glands found on the thyroid at the back of the neck. These glands secrete parathyroid hormone, PTH, which circulates around the body and regulates the amount of calcium in the blood and bones. PTH secretion is regulated by a feedback mechanism. When the level of calcium in the blood is too low, the parathyroid gland secretes more hormone, which stimulates the increase of the calcium levels in the blood, and vice versa. PTH also regulates phosphate levels in the blood by decreasing the amount of phosphate reabsorbed by the kidney. Calcium and phosphate have several important jobs, including building strong bones and teeth and regulating muscle contractions such as the heartbeat. Damage to the parathyroid glands during neck surgery is the most common cause of hypoparathyroidism. It may also be due to genetic or autoimmune causes. People with this rare disease don't produce enough PTH, which causes low calcium levels in the blood. This causes a variety of symptoms, including fatigue, seizures, irregular heartbeat, numbness, tingling and twitching of muscles, and impacting mental clarity or brain fog. Hypoparathyroidism can have a significant impact on a patient's daily life, even sometimes preventing them from working or interacting socially. Not many people know about this condition, which can make those living with it feel isolated and alone.
Pros and cons. Current treatments include supplementation with calcium and active vitamin D, with gold albumin corrected serum calcium level in low normal range of 8 to 9 mg DL. Complications of the disease include renal dysfunction, nephrocalcinosis, kidney stone, extracellular calcification of the basal ganglia, and posterior subscapular cataracts, as well as low bone turnover, and increased bone density. Issue applying in Ecuador. It was observed that in thyroidectomy group with prophylactic central emptying in Central 1 at the Eugenio Espejo Hospital in the city of Quito for 1 year. There was significant rate of hypocalcemia and hypoparathyroidism. All these patients present signs of hypocalcemia during their post-surgical period, which prolonged their hospital stay. Conclusion: hypoparathyroidism is no longer a rare disease without treatment option. RHPTH 1284 Napara appears to be a promising treatment option for those individuals who are not well controlled on current standard therapy with calcium, active vitamin D, thiazide type diuretics, and or magnesium as needed.
Hypoparathyroidism. 3 types: primary, pseudo, and pseudo-hypoparathyroidism. Primary hypoparathyroidism. Decreased parathyroid hormone secretion. Secondary to thyroid surgery. Low calcium, high phosphate. Treated with active metabolite of vitamin D. Clinical features are secondary to hypocalcemia: tetany, muscle twitching, cramping, and carpopedal spasm. Paresthesia, usually perioral around mouth, fingers, and toes. ECG, prolonged QT interval. With worsening hypocalcemia, bronchospasm, laryngospasm, and seizures. If chronic, depression, cataracts. Trousseau sign. Carpal spasm if the brachial artery occluded by inflating the blood pressure cuff and maintaining pressure above systolic. It is seen in around 95% of patients with hypocalcemia and around 1% of normal calcemic people. Gvostek sign. Tapping over parotid causes facial muscles to twitch. It is seen in around 70% of patients with hypocalcemia and around 10% of normal calcemic people. Trousseau sign is more sensitive and specific than Gvostek sign. Pseudo-hypoparathyroidism. Target cells being insensitive to parathyroid hormone. 2 types. Type 1, there is a complete receptor defect. Type 2, the cell receptor is intact. Due to abnormality in a GS protein receptor, alpha unit. Autosomal dominant fashion. There is resistance to a variety of hormones that act via cyclic AMP, including parathyroid hormone, thyroid stimulating hormone, and gonadotrophins. Low calcium, high phosphate, high parathyroid hormone, same lab results like secondary hyperparathyroidism. Also there is raised TSH with low T4, and raised gonadotrophins. Associated with low IQ, cognitive impairment, short stature, obesity, shortened 4th and 5th metacarpals, brachymetacarpals, brachymetarsals, subcutaneous calcification nodules, soft tissue calcification or ossification, round face, stocky habitus, and dental hyperplasia. Diagnosis is made by measuring urinary cyclic AMP and phosphate levels, following an infusion of parathyroid hormone. In hypoparathyroidism, this will cause an increase in both cyclic AMP and phosphate levels. In pseudo-hypoparathyroidism type 1, neither cyclic AMP nor are phosphate levels increased. Whilst in pseudo-hypoparathyroidism type 2, only cyclic AMP rises, but phosphate levels do not change. The mainstay of treatment is calcium and vitamin D. Pseudo-hypoparathyroidism. Similar phenotype to pseudo-hypoparathyroidism, but normal biochemistry. Thank you for watching. New videos are uploaded regularly. Don't miss them. Click the subscribe button below and get the new videos easily.